Right now in America, nearly 1 million people are living with Parkinson's disease, and that number is expected to rise. According to the Parkinson's Foundation, that number will rise to 1.2 million in just 5 years. And joining us now to talk about Parkinson's disease is Dr. Mian, a functional neurosurgeon from Swedish Medical Center. Thanks so much for coming on the show today.
Good morning.
Okay, so currently there is no cure for Parkinson's. Can you explain to our viewers exactly what it is and what are some signs or factors in getting this disease?
So Parkinson's disease is a neurodegenerative disorder in which there's a loss of cells in the brain that produce a chemical called dopamine. And the loss of dopamine in the brain leads to a variety of symptoms, but the usual ones that are outward that we see are movement symptoms. So a tremor, slowness, stiffness, and then difficulty with gait or balance.
Of course, we know most people know about actor Michael J. Fox and his push to raise awareness about Parkinson's. He got the disease at an earlier age. Is that unusual? And then also, he's been living with it for years now. Explain what the impact on the body is as you age.
So Parkinson's disease is typically an age of older people, older patients. We think that it affects about 1% of people over the age of 65, and the average patient is usually diagnosed around the age of 60 or so. In a small percentage of patients, there can be an early onset, and we think that this is often related to genetics. It's probably only 3 or 5% of patients. But as Parkinson's progresses, it has a variety of effects on not only movement, as we discussed, but also digestion, sleep, thinking and memory, a variety of impacts on people's lives.
So what types of treatments are best for people? Surgery, therapy, medications?
So for everyone, we try to start with medications, and most of the medications for Parkinson's disease are aimed simply at replacing dopamine that's lost in the brain. And so there are pills that patients take by mouth. But for patients who develop problems with medications over time or who stop responding to medicines, we have an effective surgery that's called deep brain stimulation, or DBS.
And of course, with many disease, catching it early is key, right?
Yeah, starting treatment earlier does have an impact on patients. We also know that, for example, regular physical exercise can have a tremendous impact on patients' experience and their symptoms. And it's something that we commonly recommend for any patient that's diagnosed.
All right. Well, Dr. Mian, thanks so much for taking the time out and talking with us today.
Oh, my pleasure. Thank you for having me.
And remember, you can watch this Health Watch interview and more on our website, cbscolorado.com.